Schools, bars, restaurants, museums, theatres and sports clubs will stay shut until at least the 28th of April. The ban on meeting more than one person in public remains, and those who do leave home for work, essential groceries or fresh air must be free of cold symptoms and stay 1.5 metres away from other people. There is mounting pressure on the country's limited intensive care unit beds and fears the current infection rates will see them overwhelmed.
You're listening to the latest world news from the BBC. 17 Romanian health workers at Bucharest University Emergency Hospital have tested positive for the coronavirus, compelling the authorities to move patients to another clinic. This comes days after 182 doctors and nurses at a hospital in northeastern Romania tested positive, and their hospital was closed so it could be disinfected. The Brazilian President Jair Bolsonaro has given another television address in which he gave precedence to protecting jobs and shoring up the economy during the coronavirus epidemic. In a much more measured tone than previous addresses, Mr. Bolsonaro said he wanted to make sure Brazilians could work during the crisis. He's consistently played down the severity of the pandemic. An earthquake of a magnitude of 6.5 has struck the American state of Idaho. The quake is reported to have a depth of 10 kilometers. It's not clear if it's caused any damage. Residents in the neighboring states of Washington, Utah and Montana felt the ground shaking. Scientists say climate change may be having a profound physical impact on nightingales, one of the world's most vocally agile songbirds. Researchers in Spain have found that they've evolved in response to Europe's rising summer temperatures. Our environment correspondent Matt McGrath explains.
With the ability to produce around 1,000 different sounds, the nightingale has long been heralded as the most impressive singer among birds. Every year, the small brown creature clocks up long distances as it migrates from Europe to sub-Saharan Africa. Now researchers say this ability to travel could be hampered by climate change. With summer temperatures have risen over a 20-year period, the birds have responded by having smaller broods with shorter wings. The adaptation comes at a price. Fewer of these sweet singers are likely to survive their long annual journey to our shores.
BBC News.
Thanks for the news, the latest, and very warm welcome to Newsday. We're always thinking about the medical staff in the front line during this pandemic. There's the risk they face, of course, but what about the decisions they have to make, the medical ethics of the doctors having to decide basically who lives and who dies, those life and death decisions. We'll be talking about those decisions a little later in the programme. Also, we'll be getting a picture from South Africa, lockdown, from Kenya, lockdown, and from LA. The story round the world with Newsday.
We're going to begin in the United States, which has reached an unenviable milestone. The country has now overtaken China in the number of declared deaths from coronavirus. Johns Hopkins University, which is keeping a global tally, says over 3,400 people have now died in the US. Meanwhile, a key member of President Trump's coronavirus, Dr. Anthony Fauci, has said he is considering advising people to wear masks when they go outside, which runs counter to the current advice.
Yeah, that's something we're going to be talking about throughout the show. We're also going to be hearing from New York, from Detroit. Let's cross now to California and speak to Dr. Cheyenne Roy, president of the Los Angeles County Medical Association, working on the coordination of the statewide coronavirus strategy. Dr. Roy, thanks for taking the time to talk to us. Can you just give us a picture of, we've been paying a lot of attention to, it almost seems that, you know, the outbreak, the arrival was New York, East Coast. Are you behind the curve on the West Coast, or hasn't it worked like that in infection across the US? Just place LA for us.
Sure, thank you for having me. So in Los Angeles and California, we took very very early and aggressive social distancing measures, among the most restrictive in the country and the earliest in the country. And so we have almost 7,000 cases, about 3,000 of them in Los Angeles currently, with about 150 deaths in California among those 7,000 cases, and approximately 50 of them in Los Angeles County. But we are hopeful that we are able to stave off the type of crisis that they're seeing in New York City here. We have seen a steady influx of cases, and we're right at the precipice right now this week to where we will be able to get an idea of whether we have truly been able to flatten the curve to some degree versus are we going to see a steeper curve like we've seen in hard-hit areas like New York City, in countries like Italy, and then obviously originally in Wuhan.
Now, that's very interesting. Give us an idea, because there is this split, obviously, between state responsibility, so California responsibility and federal responsibility. You are on the team responsible for what happens at a state level. What do you need from the federal authorities? What can they give you that you would need?
Well, at this point, a few weeks into the situation here in the United States, this is our third week really addressing the crisis and seeing an escalation of cases. There are all hands on deck, and people, from the federal level down to the state government, are down to local authorities, are working as hard as they can. The unfortunate part of it is we came into this unprepared. We are doing the preparation needed to fulfill the places we're behind. For example, personal protective equipment for our frontline staff, whether that's physicians, nurses, healthcare workers. We're having supply chain issues with that. Additionally, in some of the cities, you're seeing challenges with ventilators, hemodialysis equipment.
What can you? Sorry to interrupt, Dr. Roy, but what can you do when you have a supply chain problem? You're a doctor. I mean, what can the state do, either the California state or the federal state, to break through that?
So some of it is what's resulted is basically trying to find creative solutions, but there's a lot of barriers to them. So, for example, in Los Angeles, we're working with vendors around the world, but trade restrictions and things like that restrict bringing N95 masks in, which are the really big problem area. Additionally, there's areas such as 3D printing to reproduce masks, and there's some guidance with where you can put these masks in an oven and heat them and be able to use them the next day. But as you can imagine, these are all difficult solutions in a time of crisis. It would have been much better if we were prepared coming into the crisis. This was always going to be a crisis, but this is something where, unfortunately, we fell short in our preparation.
Well, very best wishes for the future, and we'll come back and talk to you, I'm sure, in coming days. That's the president of the Los Angeles County Medical Association, Dr. Cheyenne Roy.
Newsday BBC World Service, Lawrence Pollard and Claire MacDonald, thank you for joining us. Let's go to South Africa now, where police and the military who are enforcing a coronavirus lockdown there have been accused of unnecessary violence. A police officer and a security guard appeared in court yesterday after it was alleged they shot and killed a man simply for being in his backyard rather than inside his house. Police in Johannesburg have also been accused of shooting rubber bullets to disperse people queuing up outside a supermarket. Let's now talk to human rights lawyer Wayne Ube in Gauteng, South Africa. Welcome to Newsday. Let's just start with the man in his backyard. How on earth can that be justified? He's outside. Are people not even allowed to go outside?
So the regulations for the lockdown do not say anything about people not being allowed to be outside. The problem with the regulations is that they were done after consultation with a lot of big businesses and people in more affluent spaces, and the enforcement of them haven't really taken into consideration how a lot of people stay in your more crowded suburbs. And we have a lot of people who would stay in small houses in the crowded rooms with about 10 to 12 people. So most of the day they have to spend outside, and it's probably the best way to ensure social distancing. But South Africa has always had a history of heavy-handed policing in your less affluent areas.
And this is the issue to look out for, isn't it? But police brutality. You also cite that xenophobia is coming into play in this situation as well. How so?
Yes, so the regulations restrict trading and businesses, but they make provision for essential services, which include groceries and spaza shops. Now, the Minister of Small Business had come out and put out an erroneous statement saying that only local businesses would stay open. There's no real rationale for that. And it will also create a situation where the spaza shops that serve certain communities, where if they might be foreign owned, are the best locations for people to go out and get those essential services and essential goods. And instead it will start forcing people to centralized grocery shops where there's a lot more human density, which is not good for the COVID guidelines. And so what we've seen is a lot of foreign shops have been targeted and closed in the first 2 days of the enforcement of the regulations, and this is something we're looking into and trying to intervene with the courts at the moment.
And clearly, if you close local shops, people travel further.
Yes.
So that is also counter to the advice everyone's being given worldwide at the moment to when you go out, make it essential and keep it local. So do the guidelines need to be revisited? As you say, it's drawn up with kind of more affluent neighborhoods in mind, and many people in South Africa and all over the world do not live in those conditions. What do they need to change?
So a lot of it comes down to the interpretation. So we've been reviewing the guidelines. The issue around the police violence, spraying people in the smaller neighborhoods, the closing of foreign shops, there's nothing in the guidelines that permits that. So it's not necessarily a problem with the guidelines in that particular instance. But certainly the model of the guidelines and the way the orders that police are being given and the lack of consideration of your high-density communities has led to the situation that we're in. To their credit, the government have been making constant amendments to the guidelines. One big problem obviously has been the transportation of essential service workers who are not as affluent. And a problem is that a lot of the public transport here is what we call combis, minibuses, where people have to crowd into. And initially the regulations had said that people could not enter vehicles unless it's less than 50% occupied. But those business models don't work for those minibuses, and so they've stopped working. And that's something that the government has started amending the guidelines on, and trying to find other ways to transport people, which is in line with ensuring social distancing, but also effective and would allow for the movement of people.
People still need to go to work. Thank you for joining us, talking to us from Gauteng in South Africa. That's Wayne Newbay, human rights lawyer.
Bit of a reminder, isn't it, that the rules aren't the same for everyone. They just can't apply everywhere. 17 minutes past the hour. Reminder of the top stories. Before we carry on, President Trump is warning Americans of a rough 2-week period, saying the US was in the midst of an unprecedented national trial, echoing the words of the leader of the UN, who's kind of saying this is the biggest challenge facing the world since World War II. We're going to be going around the world, of course, talking about various angles. One in particular, which intrigues us, is this news of the loss of smell and taste being one of the first signs that a person has been infected with the coronavirus. Not all cases, but sum. There's a team at King's College London, who we're going to be talking to a little bit later in the programme. We found that 20% of people reporting suspected symptoms also cited a loss of smell and taste. Let's get to business, because of course business is being roiled by the virus. Andrew Wood is on the line from Hong Kong, watching developments for us. All sorts of disruption going on. Also, there was this massive takeover deal that we've been talking about on and off for weeks now, and that's been hit by the virus. Tell us more, Andrew.
Yeah, this is Xerox, the company perhaps best known for photocopiers, wanted to take over HP. Now, HP originally stood for Hewlett-Packard, but actually Hewlett-Packard, one of the venerable companies in technology in America, apparently the garage where Mr. Hewlett and Mr. Packard started their business in what's now Silicon Valley before the Second World War is now a national monument, would you believe, in America. It's just a little wooden shed, but it's a national monument. Anyway, Hewlett-Packard split a few years back into, it set up a new company called HP, which just makes its printers. Xerox last year said that it would bid $35 billion, a mixture of cash and Xerox shares, to buy HP, but it said now, because of the coronavirus, it's basically abandoning that now. It was always a bit of a weird deal anyway, because Xerox is smaller than HP, so it was going to be, an interesting the small fish swallowing the big fish rather than the other way around. And it's also a bit in a way that's not desperate, but printers are going out of fashion. I mean, I don't think they'll disappear completely, but a lot of companies now just do everything digital. They don't need printers anywhere near as much as before. And so it's a bit of a case of, Xerox with its sort of photocopier and laser printer background, Hewlett-Packard or HP with its printer background, trying to come together perhaps to make a better company that could survive, basically the decline of the printer business.
Fascinating. Is that a cat on the line there, Andrew?
I'm afraid it is. It's Bimbo. I'm working from home today, and she wants to sit on my lap, I'm afraid.
Bless her. My final question to Bimbo and to you, either of you can reply. Obviously, if you're talking about this kind of, the meat and drink of business, of takeovers, mergers, that kind of thing, there's a huge knock-on effect, because banks make loads of money by arranging and advising on those, so presumably they lose all of that.
Well, yes. I mean, that's probably the investment bankers have made a lot of money up until now in all the advice. But it is a bigger problem, because mergers and acquisitions have just basically dried up at the moment. I should imagine, though, there might be a big boom once we get past the worst of the coronavirus outbreak, the pandemic, because then there'll be an awful lot of very weak companies around. And if you're a big company and you've managed to survive quite well and you've got a lot of cash, look at Apple, it's got more cash than some countries have, economic output. Then if you've got cash, this is going to be pretty good. So the investment banks that survive will probably be in a very good position to try to advise the companies that also want to buy other companies as well. But that's still a long way off, a lot of uncertainty.
Andrew Wood and Bimbo on the line from Hong Kong. I'll have to be careful saying that next time, Andrew. It makes it sound like I'm being rude to you. I'm not at all. Bimbo the cat, for those of you who are just joining us. Andrew Wood with the business on the line from Hong Kong.
I'm on the line from my home this morning. I do have a pet, a dog called Peggy, but hopefully she's still sleeping soundly and there will be no interruptions, Lawrence, but who can tell? We're all on lockdown. Now, let's talk about coronavirus. Hospitals around the world facing unprecedented numbers of patients, combined with a shortage of equipment and respirators to treat those in critical conditions. So medical staff increasingly being asked to make difficult decisions about who receives care and who doesn't. They will have ethical protocols in place, of course, but how will they develop, and will they be modified to reflect the reality of the pandemic? Well, for more on this, I've been talking to Dr. Matthew Winnier, the director of the Center for Bioethics and Humanities at the University of Colorado's Anschutz Medical Campus.
We've got people working on this throughout the states, and the common points are that there seems to be wide agreement that, number one, you should do everything possible to avoid having to make really tragic choices between, who gets the last of a resource, like a ventilator, for example. But if you are in that kind of a circumstance, that you should do the most you can to not make the individual doctor taking care of that patient have to shoulder that burden alone. So many, if not all, of the systems that are being established now in the U.S. are creating triage teams, and that allows the doctors and nurses who are taking care of the patients to remain in the role of the advocate for those patients. The other thing that's accomplished, by the way, by having a triage team is the triage team can be given what we're calling blinded information about the patients, because there is also widespread agreement that you don't want factors like the race of the patient or the religious background. You don't want any of those things coming into the decision-making process. And with a triage team, you can give them data about the patients to make decisions about who's most likely to benefit from whatever the limited resource is. But you could shield them from knowing things like, is this a priest or is it a grade school teacher?
And is that necessary? I mean, have studies shown that in those situations people make decisions because of subjectivity in that sense?
You know, that's an excellent question, and of course there are no data about these kinds of situations because we've never had a circumstance like this, but we do know from other studies that even without realizing it, people are influenced by implicit biases and stereotypes.
As you say, medical staff the world over never ever thought they would have to be making these kinds of decisions. What is needed for them, do you think, after this pandemic?
You use the analogy of being at war, and if you speak to people from the military who have been forced to do battlefield triage, they are scarred by that experience, sometimes for life. And I think we will need to give a lot of attention to support for the people who are placed in these positions, as well as the frontline clinicians who end up having to carry out the triage recommendations. But, I mean, one of the things we're learning about this COVID-19 infection is that a fair number of people, more than half, who end up on a ventilator still don't survive. The reality is that when you look at some of the studies from China, as much as 85% of the people who were placed on ventilators didn't make it. We are going to be dealing not only with the trauma of not being able to provide everyone with the services that we would otherwise give them, but with the fact that many of the people who come in that you would like to be able to save, you're just not going to be able to, even if you have the resources.
Sobering words from Dr. Matthew Winier, the Director of the Center for Bioethics and Humanities at the University of Colorado's Anschutz Medical Campus.
This is Newsday, 25 minutes past the hour. Earlier in the programme, we were talking about South Africa's lockdown, allegations of police brutality, the problems of enforcing a lockdown in areas where maybe some would argue it's actually not that suitable. Let's go to Kenya now, where citizens are also being urged to stay at home in isolation. The government has imposed a dusk-to-dawn curfew to help it deal with the pandemic. The police chief has ordered an investigation into the death of a 13-year-old boy who was thought to have been shot on Monday evening as police enforced the curfew. There's lots to talk about, but let's just begin with that by saying hello to Cheaptoyman, presenter at Capital Radio in Kenya. First off, can I just ask about the death of the 13-year-old boy? Have any more details emerged at all?
No, it's still under investigation, so we're waiting to hear what comes out of it. Of course, it's a very emotional incident, given the fact that there were, we saw some brutality on the first day of the curfew, and then now to have a child allegedly killed. People are very, very emotional about it.
What has been the kind of the nature of the protests against the curfew? I mean, we were hearing a little bit earlier in the programme about South Africans complaining that actually quite a lot of the things that they're expected to do just aren't possible to do. If you don't have a separate room where you live, it's almost impossible to self-isolate. What sort of protests have been seen in Kenya?
So in regards to, I can answer that in two parts. In regards to the curfew itself, the people who use public transportation to go home are finding it very, very difficult because there's been a reduction, because of social distancing. There are few people in public transportation transport. We call them matatus, which are the minibuses. So people have got to line up for a much longer time in order to get one. And then there's the hike in the pricing that has gone up. So that caused a lot of tension, it's caused a lot of discomfort. People within the informal sector, I mean, we have people who sell street food who are saying, look, we used to make a lot of money selling off street food at night. When you ask us to sell it during the day, it's not quite the same. I saw a lady who sells fried fish, which is a delicacy in some parts, and she said, look, they asked us to go home, but when it's time to sell the fish at night, so asking us to be home at that time isn't quite feasible. Within the house, within the home, we haven't really heard about that, self-isolating the home. I think that's still something that's very, very alien, so it has not really come up in the news yet.
And has there been, I mean, one thing that we saw is a lot of street vendors in India ended up basically losing their livelihood overnight, and they all took to the roads and sort of walked off home. Have you seen that kind of urban to rural exodus at all in Kenya or not?
Because a lot of people did say after this last week, a lot of people said, well, if I can't make money in Nairobi, I'd rather just go up to the countryside. But this is being discouraged because, the nature of the virus that people who are much older are susceptible to if you come out from Nairobi, leave Nairobi to go up to the countryside, you might go against people, and that might not necessarily...
Of course, that would go against the whole point, wouldn't it? Chow, many thanks indeed. Presenter at Capital Radio in Kenya. Best wishes to our radio colleagues. Chow Tole there. Many thanks indeed. This is Lawrence and Claire with Newsday all around the world. Stay tuned. News up next.
This is the BBC World Service, where the incredible story of the doomed Apollo 13 moon mission continues.